So this spirit is composed of 4 key elements when working with clients or patients or individuals we are coaching or trying to help. It includes partnership, acceptance, compassion, and evocation. We want to explore each of these in detail. Okay, first, partnership. Again, motivational interviewing is a collaborative process where the practitioner and the client work together as partners. It's not about the practitioner being the expert who fixes the client or gives a lot of information or knowledge on a subject or dumps a bunch of information on them or advises them or even persuades them. But rather, it is a joint effort for both parties to understand more clearly the client's perspective and to work towards change. And they work towards change together. This partnership fosters a sense of equality and respect for the client's autonomy to make their own choice, but also supports the client's capability and their capability to get there. And it involves 4 aspects: absolute worth, accurate empathy, autonomy, support. Compassion in motivational interviewing is about actively promoting the welfare and best interests of the client. That makes sense. It is a commitment to approach the client's struggles with kindness and empathy, not with judgment. This compassionate stance helps clients to feel cared for and supported, which can be crucial for fostering motivation within them toward producing change. Now lastly, evocation in motivational interviewing supports that motivation for change resides within the client. This is so important to know, and to know that it is the practitioner's role to evoke this motivation. Instead of telling clients why they should change, the practitioner helps clients draw out their own reasons and motivations for change. This approach respects the client's wisdom and their capacity for this self-directed change. Now let's take a moment and just reflect on how these elements work together. Let's imagine you're a healthcare provider working with a patient who's struggling to manage their diabetes. Instead of instructing them on how they need to do it or what they need to do, you engage in a conversation that honors their experiences and feelings. You express empathy for their challenges, acknowledge their autonomy in making those decisions about their health, and explore their own reasons for wanting to manage their diabetes better. This approach not only builds a stronger therapeutic relationship, but also empowers the patient to take an active role in their health management. Now specifically, let's assign a name and make it more real. Let's say Emily is struggling to manage her diabetes. Emily expresses ambivalence about adhering to her medication or her medication regimen and making the necessary and beneficial lifestyle changes for herself. But through motivational interviewing, the healthcare provider can engage Emily in a non-judgmental conversation, asking open-ended questions about her concerns and motivations, and to help Emily articulate her own reasons why she wants better health and become more committed to following her treatment plan. As you can see through this collaborative dialogue, Emily gains the motivation to change. Let's think of another real-life example. Let's say a client named Sarah is struggling because she feels like she is stuck in her current job and is really just unsure about pursuing anything else. The reason she does not want to make changes is the fear she has of failing. She fears failing, and it has become stagnating to her. It became immobilizing to her. But through motivational interviewing, Sarah's career counselor can help her explore this ambivalence she has, to help her to elicit her own motivations for career advancement. And her career counselor can help her develop her own plan to achieve her professional goals. By focusing on Sarah's strengths, as well as her own aspirations, her career counselor supports her in actionable steps that would get her to a more fulfilling career. As we progress through this course, we'll get deeper into each of these elements, exploring practical techniques and strategies for applying motivational interviewing in various contexts. But we'll look at how to engage clients, how to elicit change talk, and how to handle resistance in a way that aligns with the spirit of motivational interviewing. In this video, we discuss the spirit of motivational interviewing and the 4 components of partnership, acceptance, compassion, and evocation. We also discuss some examples. Now in the next video, we will discuss the principles of motivational interviewing. And remember, the power to change is within each of us and those who we work with. And with the right approach, we can help bring that power to elicit change in other people. See you in the next video.